Hello, friends. This is Dr. Siddharth Lakhani, consultant nephrologist and transplant physician at SL Raheja Hospital of Fortis Associate. We are here today to discuss on commonly asked question to me all the times by my family, friends, colleagues, relatives, and of course my patient's relative. How do we safeguard our kidneys? So all of us want to get treated for kidney diseases. Once you have a disease, what I'm going to discuss is how to prevent a disease. So I think all of us believe that with time, probably with a lot of other factors like stress, bad lifestyle, food habits, probably a competitive behavior around, and a lot of peer pressure. All of us probably are seeing a lot of surge in diseases which includes communicable diseases as well as the lifestyle dependent diseases. So these lifestyle dependent diseases are very common. We Indians probably have a lot of common other issues like high carbohydrate or starch intake. We have central obesity as a common problem. Our food intake is probably more related to salt and sugar. And these are the common reasons, along with probably sedentary lifestyle, lack of exercise, uh, a trend of more alcohol and smoking related stuffs. That's again cross related to a lot of stresses at home, stresses at work, and this all probably leads to what we call as the lifestyle diseases. So lifestyle diseases will include my hypertension, diabetes, obesity, as I already discussed, and this all in turn leads to cardiac diseases, kidney diseases, and of course the increasing surge of cancers as well. So now how do I safeguard my kidneys from all these? All of us have known, and all of us have been reading, and all of us believe that exercise, good diet, good probably lifestyle helps us in prevent to get this disease. But are we able to achieve this? Are we able to get to this exactly healthy lifestyle what is quoted as? So talk on this, probably healthy lifestyle should include number one, of course, everyone right from their age of 25 should start exercising. Exercise should include a 30 minutes daily exercise, which will probably help us in becoming better wherever possible. So that is definitely there. So number one. Number two, डाइट. सो ऑल ऑफ अस बिलीव दैट एक उम्र के बाद हम खाना पीना चेंज करेंगे, हम प्रॉब्ली ये नहीं खाएंगे, वो नहीं खाएंगे, बट इट शुड बी वेरी अर्ली. The diseases what we used to see, no, probably a decade back at the age of 40, 50, now we see a lot of patients with very high blood pressure, high thyroids, high sugars, right from 25 or 30. So sorry, so your preventive strategy should start much early. So if you are going to target that, we should start like, earlier the earnings used to come very late. Now we see a lot of young population earning a lot of money at a very young age. So their job profiles change very fast. So like the same thing, the diseases have started very fast. So you have to focus on a good lifestyle, which is very important, and exercise, a diet low on salt, a diet low on sugars. Try to avoid as much as junk food possible. That is one important preventive strategy again. Next important factor, rather than the diet and exercise, is getting yourself tested. Blood pressure checkups should be done right from your 20s probably. So the moment you enter, you wherever you possible, you're going taking your mother, father, grandfather, granddaughter, or whomsoever. So wherever you're taking them, probably for checkups, try to see that if possible, try to get your pressures checked up. We are checking blood pressures for young people on a day-to-day basis, and we are finding that they are very high on blood pressures. So that is one common reason for getting early diseases, kidney diseases, which is very common. We are seeing a lot of unknown kidney diseases, but that is probably related to a high blood pressure, which is missed sometimes because it is asymptomatic. Second, get yourself tested for sugars, cholesterol. Get yourself tested for probably a thyroids wherever possible. A sonography will help me to tell whether there is any early probably a cancerous lesion, or if I'm developing something else which is there. We are seeing a lot of polycystic kidney disease these days, which is much earlier. As per literature, the polycystic kidney disease used to be seen somewhere in fifth or sixth decade or 50th or 60 years of life, and now we see a lot of polycystic kidney disease, a genetic kidney disease somewhere between 25 to probably say 35. So that is again a target oriented thing, that if I have a family history of diabetes, blood pressure, or any other genetic disease, I should get myself tested early rather than being probably at home sitting that why should I get tested, I may get a disease. So that is again wrong on the concept of that. Physical appearance may or may not, but yes, if you feel you're feeling fatigued, if you're not able to do work, if you're feeling exertion, if you're feeling tired all the day, then again you should get yourself tested. Anemia or low blood pressure or high blood pressure, low hemoglobin again indicates towards some chronic kidney disease, so probably that should be tested again. A lot of young patients have stones. Stones again are very neglected. It is like when you have a pain, they go to the doctors, they get themselves pain free, and then again they forget that there are some stones left in the kidney which can affect my kidneys back. So stone disease is one more common young patient disease which should be taken care of wherever possible. Try to see that if you have a stone disease, keep on checking yourselves as and when possible for basic tests like creatinine, which tells me my kidney function, urine, which tells me if I'm losing any protein or no, and a sonography, of course, which will tell me that if I have a stone, residual stone, or stone which is causing scarring, I am at risk of developing long-term disease. Fourth most important disease, which I think after blood pressure, diabetes, and the kidney problems, stone disease, which I discussed, is proteinuric disease. Obesity and any other glomerular diseases which are known to cause protein urea in the kidney, basically proteinuria in urine, and that is how we come to know that a patient may or may not have a kidney disease. It's again important to check your urine on a routine basis whenever possible. If you have symptoms like frothing of urine or probably dark colored urine or mild edema or swelling which is there, again you should probably see your doctor and get yourself tested for proteinuric diseases. Proteinuric diseases, if missed early on a long term, are known to cause a kidney disease on a fast go. So that is again one important factor which will help us. Lifestyles we discussed. Next important factor which is there probably, as I said, is medicines. So a lot of patients are taking blood pressure and diabetes medicines. I think each home will have a BP or a diabetic patient, some or the other age. But what is important is not taking medicines. It is important to take medicines and have a control. So if your blood pressure and diabetes is not under control, it's like I'm taking a BP medicine, but my BP is 160, 80, 170, 90 all the time, then I'm not reaching to my goal of blood pressure target. So again, I'm at risk of developing cardiac illnesses, brain strokes, kidney diseases. So again, the question is, sir, whether I will be living healthy with the blood pressure. Again, my question answer to all of them is no. It is not about number of pills or how many years of BP tablets you're taking. It is about how well controlled my blood pressure is. So the target is the blood pressure control, and we expect a blood pressure control of 130/80 in any patient whosoever at any age who's taking medicines. So of course, salt restriction and cutting down your fried foods and cutting down your protein intake is going to collaterally help you, because that is going to cut down on your kidney burden. But that is not the answer. The answer will be to control your blood pressure by multiple methods. Diet will be one, and of course the medical treatment will be two. So that is how controlling of blood pressure and sugars is very important on a day-to-day basis. Family history, the ones who have a strong diabetic cardiac family histories should be very vigilant early. We are seeing a lot of trend of family diseases. So we have a lot of patients from the same family who behave in a similar way. Probably if the mother or father has a disease at much early, but now what we see is, if you see a mother or father with diabetes or blood pressure or cardiac disease at the age of 50, chances that the son or daughter may get it much earlier is much higher. How do I prevent or how do I safeguard myself is, again, check myself regularly, keep myself healthy wherever possible, keep a check on my weight. So weight is a very important criteria. If you're losing, if you're going above your BMI or weight, you should immediately probably get a red signal in your heads that something may happen wrong or something in futuristics may go wrong. So that is where you should start probably preventing yourself. A good diet, a good lifestyle doesn't come in one go. If I start deciding that today onwards I have to live healthy, it doesn't come in one go. It's going to take a time, and that time period is probably what is going to matter, how we're going to slow down or safeguard us from diseases. So this is one important aspect. Next important aspect for probably a lot of peripheral patients who we see, a lot of unknown, unexplained medicines which are being taken on a day-to-day basis, right from antacids, right from painkillers, right from antibiotics. Recently, we saw a patient who was taking probably an antibiotic for say around 3 months, just because. So, so that was. So that was probably the reason that they have this uh, family history, which is important. So that is one important aspect which should be focused on. So next important factor, as I said, for patients whom we are seeing routinely for diseases like kidney, if when we discuss safeguarding my kidneys, what doctor, what should I do when I get a kidney disease? So that is again a second part of discussion what we have today. One is how do I prevent myself, which we discussed. Now second is what do I do when I get a kidney disease? So once you know that your GFR or a glomerular filtration rate is not into the range for your age or it's lower, once you know that you have a higher creatinine, once you know or once you probably get yourself tested and you find out that you have some protein in urine, you should consult probably a nephrologist. And from there on, we have prospects of treatment for all patients depending on what is the nature of disease, whether I'm suffering from blood pressure related kidney disease, diabetic related kidney disease, stone related kidney disease, or some unknown disease. My prognostic factors will vary. So any disease of kidney, once it is there, will have risk factors like all other diseases have. So if I'm diabetic, I'm hypertensive, I'm obese, I have a cardiac illness, I'm taking multiple medicines, and I'm not following any exercise regimens, I will be the person to progress the fastest because I have all the risk factors and all the risk factors are uncontrolled. If I'm seeing probably a kidney disease or probably disease with blood pressure only, and my target is that मैं अपना blood pressure एकदम अच्छे से control कर रहा हूँ with medicines, then my disease is going to behave or it's going to slow down. So that is where controlling blood pressure or controlling the risk factors is important. So you should know who your friends are and who your enemies are. So my enemies will be diabetes, blood pressure, my stone disease, my obesity, my weight, my diet. So once I know my enemy, I have to take care of them and I have to see to it that I'm able to control them. If I don't do that, whatever amount of medicines my doctor prescribe or whatever amount of medicines you take from your prescribed prescription, the effect is not going to be there. So that is one important factor once I get the disease. Secondly, depending, as I said, depending on the varied factors, you will have a prognostication. Your doctor will tell you that your kidneys may progress this fast, or your kidneys are progressing this fast. Next important question is what options do I have when I'm seeing a kidney disease? So first question immediately, whether the creat is 1.4 for a patient or the creat is 5 for a patient. When will I go on dialysis? This is an important question for all patients. So like for any other disease, the treatment for kidney disease is basically divided into three forms. One is your medical therapy or a stage of therapy which behaves from CKD or chronic kidney disease stage 1 to stage 5. Here your medical therapy will keep on varying. Medical therapy will again be divided into two parts. One will be your therapy. One will be basically to one will be basically to control your enemies or risk factors like controlling sugar, controlling BP, controlling cholesterol, controlling uric acid. So this is one part of therapy, taking care of my risk factors or taking care of my enemies. Second part of therapy will be to slow down the disease, reduce the proteinuria, probably use of pre-probiotics, use of keto analogs. These are going to slow down or try to probably retard the disease progression. So this is again medical therapy into two parts, and then I correctify or I probably rectify my kidney related ailments which are there, like if my calcium is low, I will put calcium to the patient. If my hemoglobin is low, I will correct. Iron, I'll correct. Folic acid, I'll correct with erythropoietin. If I have acid in urine, or probably I have acid in the body which is more, I will correct it with the bicarb supplement. So this will be my medical therapy. Then I go to patients who ask when is dialysis considered. So that's an important part. There is no specific way whereby immediately dialysis is asked for. Whenever your GFR is less than 15, you have a lot of water retention, you have acidosis or hyperkalemia, or your potassium is persistently remaining high, you feel fatigue, or there is a lot of weight loss, and you're developing probably a weight loss which is related to the metabolic factors or toxins in the body, or you have other uremic findings which are there. And this is the time when I advise my patient that it is time probably for us to go from medical therapy to dialysis. So it's a form of therapy only, whereby I transit myself from one to other. So again, dialysis is either 2 times or 3 times a week. In dialysis, we have two options. We have hemodialysis or blood-based dialysis, and we have peritoneal dialysis or a PD, which happens through a catheter which is placed in my peritoneal cavity or abdomen. So these are two forms of dialysis which we offer to patient. That is how it is, and dialysis frequency is 2 or probably 3 per week, depending on the need of patient. Next form of therapy, if doctor question asked is when will I or whether I'm eligible for a kidney transplant. So yes, any patient who's probably not who's less than 65, who's not having any chronic disease, other chronic diseases like probably a cancer or something, can go for a kidney transplant. You are eligible for a kidney transplant. You'll have to have a family related donor, which will probably either to me or to probably your colleague doctor, when you tell them that they will guide you for the transplant process. And transplant remains as the best therapy for any kidney patient, because the long time survival on a transplant versus on a dialysis, definitely transplant is going to score better. So transplant remains as an option. Transplant, again, we have one is your life related transplant. Second is your transplant, which is probably the deceased donor transplant. So if you don't have a family member who's there to donate, you can ask probably us, and we will register you to a deceased donor registry, and that is how we can probably help you out to for the transplant process. So that is second. A lot of questions asked, if I don't have a blood match donor, or if I don't have a, probably my wife is going to donate, whether it is possible. Yes, we have ABO incompatible transplants which we routinely do, and we have transplants where you can do transplants even if the HLA is not completely matching. So that is definitely there. That are again options which are available. Some myths about transplant which I would like to clear here. Many times asked कि ट्रांसप्लांट के बाद सिंगल रूम जरूरी है, AC रूम जरूरी है, किसी से मिलना नहीं है. I have probably lot of patients, relatives, even educated ones coming and asking us this question. It is not about living in a single room or living in an AC room. It is about basic hygiene, which includes food hygiene, where you're not probably supposed to have stale or a previously day cooked food, or probably a food which you think is not fresh enoughly prepared. Water hygiene means you're not supposed to have probably kacha pani, what we say, or you are supposed to have a boiled or a filtered water that will prevent water transmissible disease to this immunosuppressed patients. Next is personal hygiene. We see a lot of fungal infections, herpes in these patients who are immunosuppressed. That is because of probably poor personal hygiene. So taking 2 times a day bath, having good hand sanitization whenever possible, using mask whenever you are going to places which you feel probably are not good and infected. So ये सब चीजें हैं जिससे हमें ट्रांसप्लांट के इन्फेक्शन से बचना है. ट्रांसप्लांट में रूम में रहने से ट्रांसप्लांट की इन्फेक्शन नहीं होगी ऐसा नहीं है. आप बाहर जा सकते, यू कैन लिव, यू कैन हैव टॉक, डिस्कस, ईट विद फैमिली, देयर इज नो रिस्ट्रिक्शंस. ऑफ कोर्स वैसा कुछ नहीं है कि एक ही रूम में रहना है, बट मेडिसिन ऑन टाइम, regular hygiene and regular methods to prevent that there is no other complications happening. इतना ध्यान रखना है, रेगुलर दवाइयाँ लेनी है, और that is how probably a kidney transplant patient को हम अच्छा रख सकते हैं. Key message to all of you, in today's probably the world where everything is progressing so rapidly, message ये है सबके लिए कि whatever age, once you are about 20, get yourself tested wherever you are comfortable, which will include a blood pressure check, which will include a detailed blood analysis whenever possible. And once you have a disease, don't just stay back at home. घर पे मत बैठिए सोच के कि मेरे को तो शुगर आ गया अभी क्या होगा. शुगर बीपी को कंट्रोल करिए, लाइफस्टाइल मॉडिफाई करिए, एक्सरसाइज बढ़ाइए, खाना पीना चेंज करिए, स्ट्रेस को आपको जो मेथड्स पसंद है उससे कम करिए. कई बार डॉक्टर्स के पास आके हम पेशेंट्स हमें पूछते हैं कि मैं मेरा स्ट्रेस कैसे कम कर सकूं. स्ट्रेस ये आप ही कम कर सकते हैं, कोई डॉक्टर इसमें ज़्यादा मदद नहीं कर पाता है. स्किपिंग, जॉगिंग, रनिंग, साइकिलिंग, ड्राइविंग, रीडिंग, कोई भी मेथड, विच एवर मेथड you feel which will help you to cut down your stress and probably give you some good relaxing time should be utilized, and that is how you're going to probably have a healthy and a safe life. So this is important. I'm going to sign off. I'm going to probably say a bye, and we will keep on touch. I'm available probably at Fortis Hospital, Raheja Hospital at Mahim on a daily basis between 10 and 12. Any queries, any further consults can definitely connect to me, and we will see to it that we take care of your kidneys the best way possible to slow down as well as to prevent them. Thank you. Thank you so much.